Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, so without wasting any time, let's get started. Cardinal signs of inflammation. So start this by writing who gave it. Now, few of you may ask, bro, is this really needed? Why do we write their names? So, see, it's a way of making examiner in your side. The moment he sees these names, he will be like, okay, so this guy or girl has already written even the scientist name. So definitely he's going. Definitely he has a very good knowledge about this topic. So he becomes free. He easily gives you the mark throughout the paper. It will benefit you. So wherever there is a chance of making examiner in your side, do that. So this was first described by Celsus, who was a Roman writer, and later expanded by Rudolf Virchow, who is also known as father of modern pathology. So Celsus basically gave the Rubor, Calor, Tumor, Dolor, and later Functio laesa was added by Virchow to the this cardinal signs of inflammation. So they basically represent clinical manifestations of acute inflammation. So many of you usually what you will do, you will just write Rubor, Calor, Tumor, Dolor, and Functio laesa. You won't elaborate a little bit, add few points to it so that examiner feels that okay, sufficient answer has been written. Suppose if this comes for 3 marks, if you write this much, it is more than sufficient and you will get the full 3 marks. 5 marks, of course, you have to write 3 pages, so 1 page you can write this. So coming to the Rubor, it is basically redness which is caused by the vasodilation of arterioles and capillaries, which leads to the increased blood flow, hyperemia at the site of injury, which is mediated by mainly histamine, nitric oxide, and prostaglandins. All these topics we have been discussed in the cellular mediators video, and as well as vascular events of acute inflammation. If you have not watched that video, please go to the playlist and you can watch it. Next, coming to the Calor, which is basically heat. Now this is produced due to increased blood flow from vasodilation, that is nothing but hyperemia itself. So it increases the local metabolic activity and it is more evident in skin and superficial tissues. Coming to the tumor, which is nothing but the swelling. So this results from the increased vascular permeability. Obviously, after the vasodilation, vascular permeability increases. So because of that, leakage of exudate. What is exudate? It is a protein-rich liquid. We have discussed this before, isn't it? So leakage of exudate into interstitial spaces, which leads to the edema. So this is mediated by histamine, bradykinin, and leukotrienes. Next, coming to the dolor, which is nothing but the pain. So this is caused by the chemical mediators such as bradykinin and prostaglandins. So that this basically results in a pressure on the nerve endings. We just before discussed that in the tumor, edema takes place. So that edema puts pressure on the nerve endings, which results in the pain. So pain serves as a protective mechanism by limiting movement. Last but not the least, Functio laesa, which was later added by the Rudolf Virchow. So this is nothing but the loss of function which happens due to pain, swelling, and structural tissue damage, which leads to temporary or permanent impairment of function of the tissue. So this is all about the cardinal signs. Now coming to the outcomes of acute inflammation. So acute inflammation will end in one of the 4 outcomes. What are the 4 outcomes? We will see it now. So it depends on what are the factors which decides that this particular acute inflammation ends in which event. So they are, first of all, it is nature of injury and extent of tissue damage and regenerative capacity of tissue. Now let's see one by one. The outcomes. So first outcome possibility is complete resolution. Now this is the most common and favorable outcome. We want this outcome to happen. So when it occurs when injury is mild and short-lived and tissue has good regenerative capacity. What are the features of this? So one thing is removal of offending agent. Whatever the agent which was causing the inflammation, that is removed. For example, microbes or necrotic tissue. And the second thing is clearance of inflammatory mediators and exudate. If you remove the exudate, edema will go, right? So restoration of normal tissue architecture and function. Then coming to the mechanism, how this basically happens. Phagocytosis of debris by macrophages. This basically leads to removal of offending agent. Next thing is edema fluid removed by lymphatics. That is nothing but clearance of inflammatory mediators. And third thing is regeneration of parenchymal cells, which is nothing but helps in restoration of normal tissue architecture and function. So if you carefully observe, the features and mechanism are interrelated, right? It will help you to understand better also, and you can also remember it easily. So the example for this is acute lobar pneumonia resolving completely. Now, coming to the second outcome, it is healing by connective tissue replacement, which is also known as fibrosis and or scarring. So this occurs when resolution is not possible. We already discussed that resolution is the most favorable outcome. If it is not possible, next happens fibrosis or scarring. So what are the indications? Extensive tissue destruction and damage to tissues which are incapable of regeneration. For example, myocardium can't regenerate, right? So that is also an indication. And apart from that, abundant fibrin exudate not adequately cleared. Obviously, exudate is very much rich in the protein, so fibrin is also a plasma protein, right? So if it is present abundantly in the exudate and it is not cleared, so it will also lead to fibrosis. And features of this is proliferation of fibroblast, deposition of collagen, formation of scar tissue, and this is also known as organization. So example for this is healing of myocardial infarction or chronic peptic ulcer. Next, coming to the third type, that is third outcome, that is suppuration and abscess formation. So this happens when there is something pyogenic bacterial infections. You will study about the pyogenic bacteria in microbiology. So this basically characterized by the formation of pus. So pus basically contains dead and viable neutrophils, necrotic tissue debris, and bacteria. And what is abscess? Abscess is nothing but the localized collection of pus, which is basically surrounded by a fibrous wall. And this eventually heals by scarring. So example is staphylococcal skin abscess. Now the fourth outcome, that is progression to chronic inflammation. So when it occurs when acute inflammation fails to eliminate the offending agent. So when persistent infections keeps happening, for example tuberculosis, it's a classic example for chronic inflammation, isn't it? So that is one cause. And apart from that, prolonged exposure to toxic agents and interference with the normal healing. So what are the features of chronic inflammation? Transition from neutrophils to macrophages and lymphocytes. So neutrophils couldn't do the job, so now macrophages comes into the picture, also the lymphocytes. And other features are ongoing tissue destruction keeps happening, and attempts at repair. Angiogenesis happens. Angiogenesis is nothing but formation of blood vessels. Fibrosis keeps happening. So all these are the features. Example is chronic osteomyelitis. So those are the four outcomes. Now here is a summary flowchart which explains everything. See that, imagine there is acute inflammation. So after a period of time, a small period of time, the question is whether the cause is eliminated or not. If the cause is eliminated, then that results in the outcome of complete resolution. The cause is eliminated, now it will resolve completely with no damage. If it is not eliminated, then the problem happens. Now, it is not eliminated and there is extensive damage, that results in the fibrosis. It is not eliminated and there is pyogenic infection, then it results in the abscess. And if it is not eliminated and there is a persistent injury, that results in the chronic inflammation. So that sums up all the outcomes of acute inflammation and what happens. So that's all for today's video. If you enjoyed this question learning, then please